You're listening to the Wellness Evolution Community Podcast. I'm Dr. Christine Smith, and this is where your body becomes something you understand again, because symptoms aren't failures. They're your body's most honest attempt to protect you. Each episode, we decode those patterns with root cause physiology, nervous system insight, and metaphors that make your biology feel alive, understandable, and trustworthy. You are smart. Your body is designed to heal. Let's remember how together. Welcome back to the Wellness Evolution Community Podcast, where today we are going to be discussing the perinatal time as one of the greatest experiences of transformation. The question I want to start with is, what if the aches, anxieties, and strange symptoms that show up during pregnancy and postpartum are not random, but the earliest whispers of a body trying to orchestrate safety? And today I have a guest, Dr. Brittany Rojo, who is a perinatal and pediatric specifically trained chiropractor, birth doula, and IBCLC lactation consultant who devotes her practice to the full arc of pregnancy, birth, infant development, and postpartum recovery. Her work includes prenatal chiropractic care, the Webster Technique for pelvic balance, cranial and sacral work for infants, and a deeply supportive approach to maternal healing. She brings a perspective that blends biomechanics, neurology, and structural alignment with a grounded respect for the body's natural design. She sees families through one of the most sensitive and transformative seasons of life, and her insight is steady, compassionate, and rooted in clinical experience. So thank you so much for joining me today, Dr. Britt. It's so nice to have you here. I would love if you could tell us the story of what drew you to your specialty of perinatal and pediatric care from a chiropractic lens. It's quite a dedication to work with families during one of their most vulnerable life transitions.
Thanks for having me. Big question. What really drew me into this work, my sister-in-law, for her first birth, it was, I don't like to use the word traumatic, but it was like a 72-hour labor. And I was, I think 20, maybe 21 at the time, and realized that I absolutely knew nothing about my body as a woman. I knew nothing about pregnancy. I knew nothing about motherhood. And that's always something that I've wanted to do. I grew up in a really big family and have been surrounded by kids my entire life, and knew eventually one day I will get there. But watching her go through that process, it really made me realize how little I understood about my own body, and then just the maternal time in general. So I'm the type of person who likes to deep dive into anything that I kind of set my eyes on or get really curious about. And so that's kind of when it all started, of my research in women's health and attending births and trying to really figure out why our outcomes in birth and motherhood are so vastly different from one end of the spectrum to the other. And now I'm here, and my entire world revolves around this, and I love it so much. It's something I'm so passionate about.
Well, and I know you even do a lot of births in home with people, and you've experienced probably more births than most people. So it's such a wonderful and beautiful skill to have, to be able to guide someone in these transitions. So I'd love to start a little bit around like myths and misunderstandings. Mm-hmm. What are the most persistent misconceptions you encounter about perinatal and pediatric chiropractic, and how do those misunderstandings prevent families from getting the support they need?
Yeah, another big question, big topic. Well, naturally becoming a chiropractor, you're against the grain as it is, and against what's normal or considered normal. And I knew early on that I wanted to help people, and I wasn't entirely sure if I wanted to go into the medical realm. And so now we're here in the chiropractic side of things and the more holistic side of things. But the one thing that breaks my heart is when I hear consistently that, suffering in pregnancy is something considered normal. And it really, I think, hinders moms, specifically anyone who's pregnant. It hinders them from getting the care that they need, because chiropractic is seen as quackery or the pseudoscience, and we can get into the history of where those buzzwords come from. But I really do think that it does more damage than it does good, because it stops people from getting the care that they can deserve. Well, it stops people from getting the care that they deserve, and the help that they need, right? And so when it comes to body work in general and in pregnancy in general, there's not a lot of research. And there's this whole boom right now of like, show me the research. Well, tell me how many women are going to raise their hands who are pregnant and go through something experimental. Probably very small amount of people would do that. And so what we have to do is rely on anecdote for those types of things. And it happens in all practices, whether it's chiropractic, whether it's an OB office, whether it's midwife practice. We have to rely on anecdote because we don't have a lot of research, and it's also not seen as something that's ethical to do research on pregnant women and children, right? So I really want people to understand that, yes, I know chiropractic can seem scary, especially with the videos online that
yes,
are my nemesis.
We share a frustration of the misconceptions around what chiropractic care is.
Yes, because also chiropractic is really hard to pin down, right? Because there's so many different ways to approach it. And so that, I think, is what also makes us really confusing, because we can't really pin down a specific thing of chiropractic like we can with other professions. And so I think that's where a lot of people get lost too, and the direction of finding a good chiropractor, right? I say good because we all find our people that are good for us, right? Mm-hmm. And just like any profession too, if you have a bad experience with a chiropractor,
go shopping.
People usually just write it off. I'm like, how many times have you had a bad experience with the dentist? How about your OB? I've had some of my clients switch OBs 3 times. And so we find who fits us and what we're looking for, and who don't try to force us to do things that we don't want to do.
Yes.
But in chiropractic, because of our history in the medical model, I think a lot of it is, I had a bad experience, they're all bad.
Well, and we'll talk about this at some point, but I know both of us are very much about all practitioners collaborating, yes, first and foremost. Absolutely. So everything has its place. Mm-hmm. And I find that people in the more holistic approach to care are often written off just because it's not part of the conventional approach to care. But working with the body and body work has been around for eons, much longer than our conventional system.
Long time.
So it's really we call our conventional system traditional care, but really traditional care, original care, mm-hmm, is what we used to do in the old days, where we took care of our bodies and we took care of each other. Yeah. And it's been such a blessing to have evolved into having our blends of different styles of care for Absolutely. Different purposes.
Yep.
And each one has a purpose. But when you are in physical pain during your pregnancy, you can absolutely get out of physical pain through helping the body to be in alignment. And so I think we'll address some of these as we go along. But what would you want people to know about the difference between what they might think of as chiropractic care, mm-hmm, especially for adults?
Yeah.
The difference when you're in pregnancy, and safeties around those things that all practitioners should also know. Mm-hmm. And then infant and pediatric mm-hmm. care, which also is a completely different form.
So different.
And we've both trained in this, yes, so we have very strong opinions about it.
Yeah. Yeah, this is a hill I will die on. One of the many hills I will die on. Because, and you can agree with this, when we get out of school, we're really good at treating neck pain, back pain, hot discs, that kind of stuff, right? And then our schooling to specialize in other things, we have to do outside of school. And we get very minimal education. We get more than most of the school that we went to, but still minimal education on pregnancy and the body as a whole.
I think any degree model is a skeleton.
Yes.
And then you have to do additional education
Absolutely.
To fill it in.
Yes, yes. Especially if you really want to go into something very specific,
yes.
right? That's not a basis in school. They touch on it maybe 1 or 2 classes, but after that, you really have to take a deep dive if that's where you want to go. And so I'm a big, when it comes to understanding the pregnant body, it's very different than someone who's not pregnant. And so, for example, the Webster Technique, the hill I will die on. Yes, it is a great technique to understand, but it is 1 foot in the door to really understand what's happening in the body. It is a sacrum pelvic balance that we learn that helps in pregnancy a lot. It can be useful in postpartum too, but understanding the amount of force that needs to go into it versus not, because of what relaxin is doing to our joints, because of the different factors that are happening as the pelvis starts to expand, as our uterus starts to rise, as baby's growing and things are shifting. A lot of times what I find is people say, well, I took the Webster Technique, so I'm perinatal certified. And I'm so happy you took that certification. And there's so much more that goes into taking care of somebody in this time and taking a deep dive and understanding what happens in first trimester, not just for that body, but for also what's happening with the fetus, all the developmental things that are going into that, because the energy that we put into it during our pregnancy has direct relation to those birth imprints and those perinatal imprints, those maternal imprints. And so understanding everything that's happening as pregnancy unfolds, because pregnancy is a very humbling experience. Birth is a very transformative experience, and postpartum is a completely different ballgame. And you have to understand every single aspect of those. You don't have to go through it. You don't have to have gone through pregnancy, birth, and postpartum to understand what's happening. And I'm of the opinion that, even if we do go through those things, you can't always relate 100% to what somebody's going through, because everyone's experience is different, right? So it doesn't discredit you if you haven't had kids yet and haven't gone through the experience, if you have a passion and a love for helping this population and working in this field. And you have to do your due diligence to understand what is happening and how to take care of the body in that way.
Oh, absolutely. And I know, like we were even talking about, like people will often, they'll think of the chiropractor, they'll think about maybe laying on their side and being twisted and then being body slammed. You do not do this in pregnancy.
No.
It's very different.
It's a very different opinion than some people. But the reason why we don't do those things is because we're trying to take torsion out of the body. Now, I'm not talking about uterine torsion in a very medical pathologic way that is actually a medical emergency. I'm talking about what the fascia is doing, what the tissues are doing, and how it relates to what you're feeling and experiencing in your body, how your pregnancy is going. It's not always about feeling good, although I am of the opinion, and my joke that I say in the office a lot is, I want you to kind of forget that you're pregnant because you feel so good in your body, because that's going to have a direct relation to how you feel about subsequent pregnancies going into it, how your birth goes, and how your postpartum recovery goes too. However, there are tons of different techniques that are very gentle in chiropractic, and not every technique works for every body, right? And that's where people need to shop and find what works for them, and how it can support them in what they're needing at the time. Pregnancy brings out a lot of things that people aren't necessarily aware of that are going on in their bodies, patterns that they've built over time. Like a lot of times I get in my office a lot, I never had low back pain before I became pregnant, so I don't understand. Maybe it's just because I'm pregnant, right? All this weight I'm carrying is really hard on my body.
Your tolerance bucket got filled and your posture completely changed.
Exactly. And for example, if you are stuck in like an anterior pelvic tilt, right, where we hyperextend, all these types of things, well, all of the front side of your body is getting overstretched. The back side of your body is getting compressed. And that way, how we manage that goes one of two ways. We either continue to do this, and that's our pregnancy waddle, or we tuck everything in and try to hold it together. And then that's where we get our round ligament pains and our psoas muscles get really tight. So there's lots of different ways that our body beautifully adapts to pregnancy, and it can only do so much at one time. So if you have other things, which majority of us have, other patterns that we've built into our system, my soccer players, for example, they have a complete rotational pattern in their torso. And so they always have one side of their rib cage that causes more trouble than not in pregnancy. And that's because of what those tissues have been trained to do over time, right? And so those are the things that we can address in pregnancy to really help people thrive.
I think people forget neurology is, or chiropractic is very much about neurology.
Yes.
And helping neurology adapt and helping your muscles adapt.
Exactly.
And helping the alignment adapt. And it does not need to involve the cracking that people always think that it does.
Yep.
Cracking is more of a side effect than a goal.
Yep.
And, for chiropractors where it is a goal for them, they might want to review that. And sometimes you can overwhelm someone's metabolism with that. Now, I do both osseous adjusting, which can sometimes result in that, and very gentle adjusting, like we're talking about. But you should always have a variety of tools in your tool bag to be able to work with the specific body that you're working on. I'm going to work on a CrossFit athlete very, very differently than I'm going to work on a pregnant mom or an infant. Totally different approach. But the body work itself and helping mom's neurology adapt so she's not in pain or physically stressed out is going to also affect baby's neurology.
Yes.
And it's also going to affect her pelvis and her ability to give birth in a comfortable way.
Yep.
And I know you even like have some props with you where you can show like how the pelvis changes and how this can adapt and allow the infant through the birth canal so that you can actually have a successful birth and not have to resort to having your abdomen emergency cut into, which has its place and can save lives. And also, sometimes I get worried when there's like more C-sections than there are births. Usually it means that there's something wrong in the birthing process that we're taking on. So I think everything that you're addressing is incredibly important. And I just kind of wanted to take people through a timeline in the show today. So when we're talking about like foundational knowledge for pregnancy, when you think about the pre and perinatal period, what do you consider the most essential pieces of physiology and structure that people rarely learn about but need to understand? And this even applies to things like fertility in the first place.
My big thing that I talk to my clients a lot about is how much energy our wombs hold and our pelvis holds. You know, you hear it consistently when you're in your birthing classes and things like that. Like if you have a tight jaw, you're going to have a tight pelvic floor. Don't clench and grip because you're going to clench and grip down here. Why is that important? What is the physiology behind that? It's because we hold a lot of energy here. That's my number one thing that I always love to teach my clients about is learning how to soften and open and lengthen. That is the whole goal of pregnancy. And so your pelvis can yield to the pressures of birth. If we can't soften and open and lengthen, that's where we run into things like stalled labors. That's where we run into, you know, babies who have the cone head off to one side because one side of the pelvic floor was tighter than the other. And so their baby's trying to navigate through that. Those are just some things that I see. A lot of the other types of things that I see are the safety that we need in birth to be able to really soften and open and lengthen. Sorry, what was the question?
But basically just the essential pieces of physiology and structure that people rarely learn about, but need to understand, including even things that affect fertility.
Yes. Okay. And so with that being said, I'm all for movement in birth, and it has to be specific to what our goal is. What is our goal? Our goal is to have a baby come out of our body. And that's a really big ask, and it's a really big task. What I find is people do more research to buy a house or buy a new car or run a marathon than they do to understand the physiology of their fertility, the physiology of pregnancy, birth, and postpartum recovery, right? And so what I want people to understand is we need to bring back reverence for all of these stages, because that's where I think we are severely lacking in our society. And it really relates to our postpartum recovery, especially our mental and emotional health and postpartum.
That's going to be a whole section later.
Yep, absolutely. So really having not just the birthing partner, but the supportive partner, taking a deep dive and understanding how they can best support their partner, but what's happening in their bodies. If you're in relation with anybody else, it's really good to understand what's happening in their physiology so you know how to best support them, whether it's male-female couples or same couples or whatever. You still have to understand what's happening in their body. And if you want to bring new life into this, you need to know what both of you need.
Well, and from a functional medicine perspective, this also goes to like their physiology and their blood sugar and like the supportive partner thing starts before you ever even conceive.
Yes.
Like in functional medicine, we talk about there's usually like a 6-month period of prep to make sure that your body's not toxic, to make sure that the egg has good health, the sperm has good health. You need a couple months for that to turn over. And there's even like ties to where morning sickness can be tied to the health of the sperm. And the placenta is actually hugely a component of that.
Absolutely.
And so I think in functional medicine, like this is what we really address when people come in with fertility issues. And like, I think acupuncture can also greatly help with these things. That's why herbals can be such a good component. But it is everything from emotional safety to physical safety. Like, is your pelvis actually prepared to carry a baby? Which is why we are passionate about the physical body and getting things aligned. Because if you're physically incapable of doing it and you can't keep having miscarriages, it might be something to look into. And then the other component is, do you feel emotionally safe? Also tied to miscarriages. And the other component is, are you even chemically balanced enough to do this? And are the sperm in the egg healthy enough to make a healthy baby. And this is tied to blood sugar. This is tied to toxin exposure. This is tied to your gut health, all of these things. So all of these environments have to be in a good place to be able to produce the healthiest baby possible. And yes, there's people that conceive by accident and they are maybe not the healthiest and their baby still turns out great. So there's that too. So don't let it make you afraid of things, but we want to educate you so that you can feel empowered in this process and know things that you can do if you're struggling, other than turning to false ways of impregnating yourself, even though those can be great for a lot of people. Putting your body through those procedures can be stressful.
So stressful.
And if it's just taking care of yourself physically and tweaking your diet a bit and getting some counseling and doing meditation, and all of a sudden your fertility works, that's a much nicer option. And then you can always go to the other options later as a last resort. So I just want people to know that that is possible.
Absolutely. And that goes into, right, the education.
Yes.
The education that should start like 6 months to a year before you want to conceive. But our view around birth, pregnancy, conception, postpartum is, you know, we were taught how not to have a baby for the most part, condoms and birth control, yay, or don't have sex. And
the birth control thing is huge too, because if you've been on birth control for a long time, it affects your hormones and your gut, and it takes time of getting off of it for your body to rebalance.
Absolutely. Yeah. But that's like how we've been taught, right? And then we have like that scene from Mean Girls, right? If you have sex, you're going to get an STD and die. Now we're afraid of it, right? So everything around this, again, going back to that reverence, everything around procreation is very scary, very hard, very difficult. And so when we are taught that mindset going into it, that's something that we have to kind of rework. And it takes some time to practice that mental state shift that we have to do when we go to start this process. And then on the other side of things, when we look at what birth is, any movie that you've watched, what happens? A woman is on her back. She's screaming her head off. She's yelling at her partner. She's emotional. She's hysterical. And that theme of just taking care of women's health in general has been part of our culture for a very long time. And it's something that needs to shift because, you know, women were deemed hysterical and had hysteria because our hormones were shifting and all that kind of stuff, right? So just in general, it takes about 6 months to a year to rework what we have been conditioned to believe of what this entire process is. That in itself can have a huge impact on your physical outcomes, right? Because that is the environmental factor. We know how powerful our mind is. All this talk, which I'm so excited about, that we learned in chiropractic school of what is your nervous system doing? How is it responding? What is your cortisol doing because of what our thoughts are? What is the constant thing that you tell yourself all the time that you're subconsciously not aware of? So those are all practices that have to go into this.
Well, I know we were even looking it up the other day. In chiropractic school, we actually get twice as many hours in diagnosis and neurology as med students in the base programs. Now, if you do a specialty, that's different. But we get a lot of neurological education. So I find this all fascinating. Let's just talk about history for 1 second here before we move on to some things.
I'm here for it.
So first off, you had mentioned like there's this whole history of like women being hysterical. That was kind of being viewed as hysterical in pregnancy. That was kind of as we moved into the industrial age. But let's do a little timeline of like, what was the ancestral way of birth like versus when we discovered hygiene, and then moving into the industrial age of, I'll let you describe what was happening in that time, and then coming into how we can find balance between it all now.
Yeah. I mean, we have been giving birth for a very long time.
None of us would be around without it.
Exactly. Without interventions and things like that. And the argument that a lot of people will say, well, we are saving more lives, we're saving more babies, we're saving more moms with the help of medicine and the Western medical model. Yes, and we also have a lot more harm that's being done. And it's not to say that people who get into this work are monsters and they want to hurt people. It's the complex that has been created. So before, again, that I will keep going back to it.
It all comes from a really good intention. Like people are wanting to do all they can to support. But this is where we come back to understanding the foundational physiology of this.
Yeah, natural physiologic birth is very different. And it's not as straightforward as putting a rod in someone's femur because they shattered it. Very different. And there's nuance even in that. But when we had more support for natural physiologic birth, we had more reverence for it. And I'll keep coming back to that over and over again, because that is where we have lost it in our society. And so when it comes to what we used to do was we had babies. And if you look at, we had midwives. But even before midwives were a thing, we had our tribe of people who supported you throughout the entire process, people who had the experiences to be able to support you through it. And yes, of course, as we've gone through and we've gotten more advanced, I say that lightly, because yes, and in terms of what we used to think, when birth went from home to hospital setting, we didn't know that it was a good idea to wash our hands after dealing with a cadaver and a dead body before sticking our hands on a woman and delivering a baby, right? A lot of women died of sepsis when that was happening. And then we learned hygiene. Yay, let's wash our hands.
But then interestingly enough, the guy that pointed out the hygiene component, they thought he was insane, and they put him in an insane asylum, and he died 2 weeks later. And then they realized that he was right. So just when I know that we're presenting some ideas that might counter the status quo, and we're not saying that the status quo is not a good resource.
Yes.
We are saying that there is a spectrum that you can travel along, knowing this education, because also, even like we were talking about this the other day, in history, they used to basically strap women down and drug them. And
Twilight
Twilight birthing. Yes.
Yeah.
And now we've discovered that that's really not the best result. And I believe you also said like men weren't allowed in the room.
Yeah. Because it was scary.
Yeah.
And women weren't knocked out completely. They were still somewhat conscious, but their memory was wiped out. And so they didn't have any recollection of what happened. And my grandma had 3 twilight births. So talking with her about it is insane. And this is where I'm kind of in the middle ground of, yes, I am supportive of the safety that comes into it. Like, I'm so grateful for medicine because it can help with things that we never used to be able to help with, right? So I'm very grateful for that.
Absolutely.
And birth is not a pathological event.
No.
And that is how it is trained and looked at as we go through of what we used to do versus how we view it now, right? Is natural thing. We did it for a long time. Was it scary and dangerous sometimes because death is a part of childbirth? Yeah. And that's a topic that not a lot of people like to talk about not to make people scared about it, but the realities of what can happen, right?
Just so partners can also realize how important it is to support your woman as she goes through this process of basically opening a portal in her own body.
Absolutely. Yeah. And completely changing, right? Everything in her body is changing. And that's just
including her brain.
Yeah. The whole part of where we actually do lose some gray matter for neuroplasticity, we write it off as, well, it's just because I'm pregnant. Yes, and, right? I always keep coming back to the yes, and things because we can't just write it off. Let's understand it so we can support people better. And pregnancy is hard because your body is going through so many changes that it's really hard to prepare for. You can ask people how it is, but again, everyone's experience is different. So it's really hard to know what it's going to feel like. You also are very tired because your body's doing a lot of work. You're not just growing a baby and their entire system. You're also growing a new organ, which is your placenta, and you're growing new mammary tissue every single time. And that's different for every single one. And so that's all happening. Plus, you have to be a functional part of society because growing a human is not considered that. You have to be a part of the workforce to really be considered to do any good, just in our society in general. So you're doing that, trying to be functional and good at your job still while your body's going through something completely different where it doesn't feel like yours. You're also trying to be a supportive partner as well. You're trying to be a daughter and a sister and all the things that go into how much pressure our society has put on people in general, whether you're pregnant or not. But in pregnancy, it's even harder. And so I feel like as our society has shifted and changed, those are the other stressors that come with it that I think have done more harm than good for all of our pregnant mamas.
Beautifully stated. So I'll point out to people, if you kind of want to learn more about these processes, there's 2 documentaries that I would direct you to. Mm-hmm. And this is just to remind people, like, one of the best questions to ask is, who's making money off of this process and who might have external influences, and how many times have we been able to give birth where nobody made money? So just a concept to think about. And the reason that we brought up the chiropractic stuff, and it's not to like be against anybody. Like, we are all about collaborating as practitioners. We should be a team and a force of nature to help people through whatever they're going through. But just so you guys know a piece of history, there's a documentary called Doctored, and it was about, in history, how the chiropractic profession was basically plotted to be eliminated through propaganda, because they basically said that we were practicing medicine without a license. And this essentially was because the AMA had an entire branch dedicated to eliminating the profession of chiropractic. And there is written evidence of this. There was a leak from the AMA that basically made all of this public. And then there was a Supreme Court case where they got persecuted for monopolizing medicine, and chiropractic won the case. And this is why chiropractic is not underneath the AMA and is considered a separate profession. So just know that, like, there are pieces of history where propaganda was used to manipulate people's perception of natural medicine. You can also look up something called the Flexner Report. And this is the history of medicine, of basically how a bunch of natural medicine schools were completely wiped out in around the period of the 50s. And when there was a lot of investment heavily in medical schools by the pharmaceutical companies. And I want you guys to know these pieces of history so that you can make decisions that are right for you. We are not against any kind of pharmaceuticals or medicine. We think it can be life-saving and can help people in great ways. And there's also a component where people have not been taught this history. And I want you to be able to make up your own minds of what is right for you.
Absolutely.
The other documentary around birth that's worth looking up, that I think you can find on YouTube, is called The Business of Being Born. And it goes into the cascade of events that generally is intended to be life-saving and helpful for the process, and can also inhibit the physiological process of birth itself. So I would love to now step into birth as a physiological event. What do you wish more people understood about the birth process itself, especially in terms of how it shapes both the mother's body and the baby's early neurological and structural patterns?
Birth is a portal. And this is where the woo-woo-y side of it gets into the physical and like sciencey side of it. And in my opinion, and I'm sure you agree with this too, but woo-woo is just a title that we give things that we aren't ready to take responsibility for and understand. But I'll use it in this context. And birth itself is one of the most transformative times that someone is going to go through in their life, not just for the woman who, or the person who is birthing, but their partner as well, because it's the first time, majority of the time, that they're ever going to see them in this type of state where they do transcend realms. Literally.
It's like a natural psychedelic state.
It is. Yeah, it really is. If we are allowed to get there. That's the other side of it. And that's the difference between suffering in birth and having a really positive birth experience, right? Is if we are allowed to let the things unfold the way that they need to. Again, caveat always, there's nuance when it comes to medical emergencies, right? Of course. And a lot of times things that are deemed medical emergencies sometimes actually aren't. But it's because of the fear that we have around birth. Because when we think of birth, we think, oh my God, women die. If we didn't have medicine, women would die in childbirth every day. Not always, right?
Well, and let's talk about the physiology a little bit, because I'd love for you to outline the proper physiology of what happens. But part of what's gone over in that documentary is the cascade of events where I know a lot of women will opt for an epidural, which I understand. And also you are numbing the musculature needed for the job. And then there will be another intervention with something like Pitocin to contract the musculature. And then they contract too hard because it's not being neurologically controlled, because everything is numb and it's chemically induced. And then the contraction of that will put the baby in distress. And then they will want to do an emergency C-section because the baby is in distress. So technically in that scenario, they're doing the right thing. They are saving the baby. But the question is, if we let the body go through its natural process and we prepped all the tissues correctly, would those interventions be needed in the first place?
I say yes and no, right? Because I do have in my clinical practice where people have said, I did all the things and I still ended up with a C-section, right?
Of course, that happens.
Happens all the time.
And like one happened for one of my patients because the baby aspirated meconium.
Yeah.
Like
right.
That's a right time for it.
Yep, exactly. There are cases where we do all this prep work, and this is where I say to my clients all the time is baby has the inside scoop that we don't, right? There are things that not even an ultrasound is going to pick up.
Correct.
Because they are very intuitive. We don't give babies enough credit for how intuitive they are. They are souls that have chosen to come here and experience whatever they need to experience, and they are way smarter than we give them credit for.
And moms are intuitive too.
Absolutely.
Stop giving away your power, moms. You're
Yeah.
very smart. Listen to yourself.
Yeah. And that's part of the preparation work that goes into it, is teaching people how to listen to their intuition again, because that's where it's super important in the unfolding of birth. Because if we're talking about, the first half of labor, early labor, where it's that like 0 to 4, maybe 0 to 5 centimeters, that looked completely different than what active labor looks like, than what transition looks like, and then what baby actually coming out looks like. And then also getting placenta to come out on its own. And I don't use the word deliver because they're not pizzas. Even though they're shaped like one, it's still, we're born, not delivered. But with that being said, all of those stages unfold very differently, and movement is so, so important, which is where I educate my patients of, if you want an epidural because we're afraid of the pain, first, let's address that fear before we make any other decisions. And if you decide that the epidural is still something that you want, is that going to be good for you? Absolutely, let's go for it. Then let's prepare you to be able to ask the right questions of, do you do walking epidurals? Can we start on the lowest setting so it'll kind of not numb the pain, but take the edge off for me to still feel pressure and sensations and be able to move my body how I need to?
And listen to your intuition based on what you're feeling.
Exactly, right? And so if we're allowed to let that birth process unfold as it needs to, and, even if we have an epidural and we can't really move our legs, this is where your birth team, like a doula, comes into play, and they're the ones helping you move. Your partner is helping you move your body, because I'm going to pull out my prop. I brought my prop.
And fascia is such a huge part of this, right? It is the neurological net in your body that is controlling your organs as well. And
Absolutely.
so it thrives on movement.
Yeah, thrives on movement and softness. Yay. But if you look in through here, I don't know, can you guys see that?
And for those listening, she's basically holding up a pelvis. We're looking through the birth canal.
But this is not perfectly round, right? And so these tissues.
And a sacrum is in the way.
The sacrum's in the way. We have these spines in our iliums that need to stretch and open. And then the sacrum needs to open and lift, right? And the pelvis is the most dynamic in birth when you have a body moving through it, right? There's, some studies that show, well, because of relaxin, the pelvis doesn't move as much as we say it does. And I got into an argument in chiropractic school with one of our professors because of it. But it's the most dynamic in labor, and we need to be able to have access to that in terms of what our soft tissues are doing and what our muscles and our tendons and our ligaments and all of those things being able to move out of the way. There's actually pictures of women in labor where the sacrum is being pushed out of the way, and it's so beautiful and so cool. And if it's not allowed to do that, that's where we have our stalls. If we're not allowed to move in labor, that's where we have our stalls. So I never, if I'm attending a birth, I never have a woman in one position for an hour on end, because there's no way.
If you're laying on your back, the sacrum is trapped and it literally can't move.
Yeah. And there are things, if that needs to happen, then there are things that we can do to be supportive. We can roll up towels and stick it under your sacrum to give it more space to open.
Yes.
Right. But this is where the education part comes into play.
But it's allowing movement even while you're on your back.
Exactly. Right. And what I really want to stress is the education that goes around it, because we don't know these things when we go into it. And we're usually kind of learning it maybe around 37, 38 weeks in our birth class, and maybe not. And at that point, you are so in a different world that it's not always going to stick. Right. And so learning these things earlier rather than later, and understanding that physiology, right, of pelvis being able to soften, where is baby in your pelvis? Are they sitting really high? Why are they sitting really high? Is your psoas super tight to where they can't soften to allow everything to come down and engage into your pelvis? My favorite thing that I love to talk about is the education of what the cervix does, right? It's a turtleneck, essentially. It is not a flower that opens up and blossoms. It's a turtleneck. So if you think about it, When we look at a turtleneck, the fibers are really thick, the hole is really small, and what happens as you pull your head through is we do this. We soften and those start to thin, that's effacement. We push our head through and that's dilation. But all that has to happen in a very progressive way. There are the things called the cardinal movements of birth, which then relate into the primitive reflexes that go through our development, right? We'll get to there. But those are all very important sequences that happen from labor starting all the way to the finish line. And all of those tissues have to open and lengthen to be able to allow that to happen.
So well said. And I think all of this, the reason that we are also passionate about natural birth is when the infant goes through the birth canal itself, it receives neurological inputs, pressure, an entire microbiome that affects your immunology for the rest of your life.
That's why babies come out facing the anus. It has to coat their entire, their body doesn't make mistakes, in my opinion. It's a very controversial topic, but it is doing what it knows best, what the program and what the neurology is on a very primitive level, right? And there's a reason why the cardinal movements of birth are what they are, because we have to get that coating for our skin microbiome. There's a reason why babies come out facing mom's anus. There's a reason why we poop in labor. Happens. There's a lot of pressure on your bowels. And so obviously you're not going to poop on your baby. You have your team to just get that out of the way, but it's still priming all of the microbiome. And it is a very beautiful, delicate, and very, very smart system. And it does it for a reason.
Yes. Innate intelligence will be more intelligent than we'll ever know because we come from this. So even as we try to understand it, the only way to fully understand it is to admit that we can never fully understand it.
Exactly. Yeah.
And we have to honor the natural intelligence of nature.
I learn something new every day.
All the time.
Every birth, all the time. Like, there are so many cool things that pop up that I was like, oh, I didn't know that was possible. This is awesome. Now I know more. But I also want to speak to like the sterility of things, right?
Mm-hmm.
Because birth is anything but real sterile. I will tell you that. There's lots of fluids coming out of everywhere, lots of different things happening, again, for a reason, but I equate it to bread, for example. Before, when we were learning about germs, I say germs lightly, it's another conversation for another time. But when we're talking about those things, we used to think the healthiest was to completely sterilize it. Sliced white Wonder Bread. It's going to be the best for you. There's no germs in there. This is what we need. And now we know we're getting sprouted whole wheat. So it has the germ in there. So it's easier for our digestion to process. It's the same thing in birth. Birth has a lot of fluids coming out of everywhere. And I feel like when we went into the hospital setting, we were trying to keep everything clean. And now we're on the other side of it. I think we're starting to shift over to like, these are actually really beneficial fluids and things that don't always need to necessarily be wiped away all the time.
I know in C-sections, they're also telling people to take the mucosa of the vaginal microbiome and wipe it on baby's face, but it's still not the same as having your entire body coated in it.
Yeah, exactly. And at the same time, right, not to discredit anyone who's had a C-section, of course. I know that's not your goal.
No.
And how do we educate, how to prepare for those?
Yes.
And this is
what
where,
can you ask for?
Exactly.
What are the questions you can ask for?
Yep. And that's where birth preferences come into play, right?
Yes.
I am not of the opinion that like, oh, if we speak it into the universe, it's going to be a thing. Yes. And when it comes to birth, we have to be prepared. We have to be prepared for any type of pivot to happen. So if and when it does happen, we know what we feel most comfortable with. We know where we can kind of compromise a little bit, where we need to make a bigger shift. That's what your birth plans are for.
And this is why it can be so helpful to work with a doula or a midwife or someone that's helping you come up with a birth plan, who's an advocate for you, who's teaching both you and your partner so that your partner can advocate while you are off in some other realm in a psychedelic state where you are basically transmuting a soul from one realm to another. Yeah.
And it's not the fault of the OBs, right? And that's the one thing I am never against if you feel safer with an OB versus a midwife and that type of stuff. However, the system that your OBs are a part of is not meant to help you. And that's a really hard pill to swallow because they get 5 minutes with you and then they have to go to the next one. They don't have the time to sit with you and talk about all of these things.
They're in a tough situation.
Because their hands are tied. And so a lot of times I get that I wish I would have known this sooner, right? Whatever that topic is. Or why didn't my OB sit down and talk with me about this when I told them I had leg cramps and all I needed to do was take some magnesium and balance out my electrolytes? Because they don't have the time. And it's the system that they're a part of that is tying their hands in that way.
Absolutely. So we are very much an advocate of all practitioners and also seeking out the ones that can help you fill in the gaps.
Yep.
So what are your thoughts on the transcendental state that you go into during birth that you've seen after helping so many women go through this process?
Yeah. It is so beautiful. I get very emotional every time I get to witness it. So, of course, I'm a watery person. We'll probably cry a little bit in this podcast. It is so beautiful. When a woman, and I say allowed, right, because it depends on the birth team, but when a woman can be in the safety of wherever she is, but she feels so completely safe to be able to change her entire physiology to allow that portal to open, the equivalent of it is like a psychedelic trip, like we've talked about. And those are the natural chemical hormones that we have in our body so we can get through birth. Because birth is intense, right? It is a very, very big process that your body goes through, and it's not comfortable. And I have watched women completely just breathe their babies out, not making a noise at all. And that's not everybody. And I've seen women who needed to do more of that guttural deep hum. There's a reason why, like the is really important in understanding why getting deep and low versus high and tight.
Vagal toning to turn on the vagus nerve to stimulate all of your visceral organs.
Exactly. And that when we're high and tight, we can't get to that very low, deep opening that we need to. And so the transcendental state really happens, like I would say I've seen it active labor around like the 9-10 centimeter into transition before baby really comes out. Is you see it like transition is the moment where women get into the I can't do this. If we hear that consistently in that time, it's a good thing. It's a good thing. That's always a telltale sign that baby's almost here, because the body, again, is going through such a big process, and there's a lot of energy and there's a lot of emotion that go into it, and all your fears tend to pop up during that time. Whether you've worked through it or not, there's something that's going to pop up that you didn't know was going to be something that was going to pop up in birth. And that's where your support team is there for you. And when we let a woman labor the way she needs to labor, she can really drop down and into that transcendental state. And she kind of just...
She can hear her intuition.
She hears her
intuition. Know the right times to push and tear less and things like that.
Well, and even like you don't have to push. Our pelvic floor was not meant to withstand 4 hours of bearing down and purple pushing and all that kind of stuff. Your uterus, and they call it a bag of muscles, and I haven't found a better terminology for it, but your uterus is the one that it's meant to contract and bring baby out. Your uterus is the one contracting and bringing it down. It's not your pelvic floor.
And the muscles are also designed in a spiral, and you can't do that with your pelvic floor.
No, you can't. And it's just, I always relate it. I was like, I always say, have you ever tried to, if you've been constipated for a really long time and tried to force out a bowel movement, how great does that go for you? Usually not very well. And birth is the same thing. If we are bearing down and purple pushing and holding our breath and, okay, next contraction, we're going to bear down and do all this stuff. Our bodies were not meant to do that. We were meant to allow the uterus to do the job that it needs to allow baby to rotate, to allow all of the things to happen instead of pushing against something like this all the time. That's exhausting for you and for baby, right?
Beautiful. So now we've passed this birth process and we've gone home. Regarding postpartum period, which I think is one of the most important periods to address and is greatly skipped, and usually where your entire birth team totally drops off and then you are alone.
Yep.
When you're at your most vulnerable, most transformed state. In your experience, what is the most important truth about postpartum recovery that gets overlooked and minimized? And how would you want new parents to approach those first weeks differently?
Yes. I am not a fan of our bounce back culture. That is the number one piece of education. If I could give anything about postpartum, is just like a marathon, you're recommended to rest 1 to 2 weeks after running a marathon. And when usually, within that week or two, my mom after birth, they're like, all right, I want to get up. I want to get out of the house. I need to move. I need to do all these things. we just went through something that we've never done before. And it's not just healing the physical body, but it's integrating everything that just happened mentally and emotionally.
With your new neurons.
With your new neurons that you're going to build consistently for up to 2 years postpartum, so you can be more attuned to your baby. Mom instinct, hey. And when it comes to the recovery side of things, we have to look at how your pregnancy was, how your birth unfolded to get to where you are right now. Once we do all of that, we can have a really good idea of where to guide your healing journey, because postpartum is considered up to 2 years. And so we have to really pay attention to all of those factors so we can support our moms the best in postpartum. But yeah, our birth team falls off. We have all these prenatal appointments, and then you have baby, you get to home and they're like, cool, we'll see you in 6 weeks unless something traumatic happens to you. Like you still have bleeding, 3 weeks, 4 weeks postpartum, right? Things like that. But I want people to know and be okay with resting. We have a really hard time in our society taking a break, but we can take a 2-week vacation and take a break, but we aren't willing to take 2 weeks postpartum to sleep in our bed and stay in our bed majority of the time. I'm a big fan of the 5-5-5 rule. It's 5 days in the bed where people are bringing you food, they're bringing you water, you are feeding baby, and then they're going to change baby and burp baby and put baby back down into your arms. Like that 5 days is not that long. It used to be the 7-7-7 rule. We've gone to 5-5-5, but that is the first half of it. The next 5-5-5 is now you're sitting up in the bed. You're allowing a little bit more movement, letting your uterus shrink back down to size, letting all of those tissues heal and soften and come back together.
Letting that portal that can be the size of a dinner plate close.
Mm-hmm. And that is where now we can kind of start moving around a little bit. And then the next 5-5-5 or the next 5 days is now we're moving around the bed. We're still kind of in our home, in our nest, and allowing us to integrate this new transition. I think 2 weeks minimum before anybody else comes into your home outside of like a postpartum doula is super important, because you and your partner are now learning who you are in this new state with a human being that you are now responsible for. It's different in pregnancy. You don't have to think about it. Your body is doing all the work and you don't have to consciously be aware of what's happening all the time because it's just going to do it. In postpartum, where I say it's a completely different ballgame, is now you and your baby are both back in diapers. You have fluid still leaking out of every orifice. You're learning how to breastfeed if that's what you choose. But even bottle feeding, it's a skill that both you and baby have to learn together. It's natural, and it's still a skill that they have to strengthen and perfect and understand the process of what's happening in that. But the first 2 weeks is a very, very important, integral time for imprinting, as for you as a couple and for the stress and the environment that you want your baby to be a part of. And it's not that family is stressful, right? Family can be super helpful, but regardless, your brain is going to be in more host mode than recovery and healing mode when you have family there. And that's just the nature of us as humans. We are community-based people, and we always want to like check in, see how people are doing, take care of them. That's just the nature of who we are as humans. And so that's not a bad thing. But in those first 2 weeks, I always want people, if we can, is just be you, your partner, your baby, and your postpartum doula.
And it can be great to have the advice of your community, and everybody's experience is different.
So different.
And that time allows you to figure out what is right for you and your partner as you step into this new role of who are you as parents instead of what you were before. Yeah.
And the comparison that happens online, like social media is my nemesis for pregnancy, birth, and postpartum. It's hard not to compare, of course. And being able to kind of just step away from it and figure out what works for you. Because again, like you just said, everyone's experience is different. And first baby is different than second baby. And second baby is different than third baby. So every time is going to be completely different. And understanding that side of things, I think is super important in our postpartum recovery. But then also it helps with our mental and emotional health afterward as well, as our hormones drop tremendously once placenta is out. But being able to be okay with very small, gentle movements. Very, very small, gentle movements. What I do tend to see is when we get that 6-week all clear, that, what that appointment is for is it has the uterus shrunk back down to size appropriately. Have those stitches, if we had any, have they healed appropriately? Do we have any major like mental, emotional things going on, right? Those types of things. But I think it needs to happen sooner than 6 weeks. That's why you have other people to help you and support you, like a lactation consultant or a postpartum doula or things like that, your family, although they're not always well versed in like some of the more
people who have studied and trained
Yes.
and have a history of seeing this done many times over.
Yep, absolutely. Thank you. I was like, where am I going with this? But what I see often is once we get that 6-week all clear is they're like, okay, great. I'm ready to jump back into full-blown exercise. And I'm like, we still have relaxant in our system up to 12 weeks postpartum. And so I see a lot of rolled ankles. I see a lot of knee injuries because they want to get back into Pilates and be strong again.
But your ligaments are still vulnerable.
Ligaments are still very vulnerable. And so this is, in our practice, what we do is we carry them through, for example, pregnancy. Depending on when they start with us is maybe we're addressing the patterns that they've had in their system before they got pregnant. So we're working through that. Then we're going to focus on birth prep kind of stuff, not because your body can't do it, because we want it to be really efficient. Yay. And then postpartum recovery, we say the first 6 weeks after birth is acute recovery. The next 6 weeks is building our foundations back before we go back into full-blown exercise. I am sorry, but after 6 weeks, we are not ready to run. Our pelvic floor is not ready for that.
Well, and this is also why I really love having a perinatal chiropractor on your team is because you have all of these birth specialists who are trained around all of your birth stuff and can help you through the perinatal process, the birth process, and the postpartum process. But the beauty of having a chiropractor on your team is they knew you before you even considered getting pregnant.
Yeah.
And then they knew you when you were getting pregnant. And then they knew you through your entire pregnancy and through your birth and through your postpartum. And then they're seeing you and your kid for years afterwards. So you have this like long-term advocate that knows you and knows your body and knows your infant and is there for you the whole time. And it was actually one of the reasons that I chose to be in a form of care where you got to watch families grow up.
Yes.
Is because you have it, when someone's going through a challenge, when they lost their job, when they had an issue at their house or when their mom died. And then you get to be there for them through all these different life experiences as like not only a professional, but as an advocate and as a support system who knows them. So I think all of these are huge. And this is even more important when someone is having a really hard time in postpartum, because I think one of the things that's not talked about enough is how it's not only hormones. It's also energetics.
Yes.
And there can be unprocessed early childhood trauma that suddenly comes out when you now have an infant in your arms that was the age that you were when something traumatizing or scary happened in your life. And traumatizing doesn't have to be some drastic event. It's just about what happened to your nervous system at that time in your life and was something scary for your nervous system. Yeah. What are your opinions on that?
I wholeheartedly agree. Like, absolutely agree that, and it's the same thing in birth, it's the same thing in pregnancy. There are going to be things that pop up that, again, our conscious brain versus our subconscious brain, that we aren't necessarily aware of, that we have to work through. And this is where I say this entire ecosystem that we're creating and this entire journey that we're going through is going to bring up stuff that we had no idea we were holding on to.
And then there's the whole identity crisis of becoming a whole new identity of who you are. Like I have a psychologist friend and she specializes in this specific time.
Yeah.
So I just wanted to make sure that we talked about that for anyone who might be having a hard time in their postpartum. There's nothing wrong with you. You're not alone. It's okay to ask for support.
Intrusive thoughts are normal and we don't talk about it enough.
And they should be addressed if they're there.
Exactly. Yes. We need to talk about it and not be embarrassed about it. I've had conversations with moms who, everything was beautiful. Their pregnancy was beautiful. Their birth was beautiful. There wasn't anything major traumatic. And they come out in motherhood and they're like, I thought I would be happy. And I just kind of feel mute. And I don't have a lot of excitement around having a newborn. And I should feel so lucky because people can't have babies. And then we start to gaslight ourselves and we go down this rabbit hole and we start to spiral and we don't talk about it because we're ashamed of it. And this is where postpartum maternal mental health is really important.
And I am always a big advocate of helping people not be ashamed of their shame.
Yeah,
Like,
absolutely.
Shame is just a agent for growth. Like,
Yeah.
listen to some Brene Brown podcast or read some of her books. Like, shame and vulnerability are some of the most powerful agents in our lives.
They're great directors.
Yes, if these things are coming up and you don't have someone in your life that you feel safe to talking about it, find somebody.
Yes, please. Yes,
like,
please.
Find somebody who is trained to hold you in this space so that you're not going through it alone, because you will be healthier. Your nervous system will be healthier. Your baby will be healthier.
Yeah, absolutely.
So as we wrap up, I want to start to come in and just touch a little bit on pediatric development, because we wanted to talk a little bit about primitive reflexes. And then this can be like an entire another podcast. So we might have to do that another day to dive into the whole pediatric component. But we'll kind of end with this so that we complete the whole bit of a journey for you. So one of the things we talked about when going through the birth canal is all these pressure points that were hit and things like primitive reflexes. And this is one of the things that we do a bunch in chiropractic care to track the development of children throughout their life and make sure that their brain is developing correctly. If you address these things right, it can prevent dyslexia, it can help immune function, it can help a whole bunch of things.
Ear infections, torticollis, colic, breastfeeding, latch issues.
Yes. So these are all neurological techniques that can be applied that are not often addressed at pediatric checkups. So I think it's important that parents know about this, because I've often brought it up and they say, what are primitive reflexes? Like, okay, great. Let's have a whole conversation. And I've even seen this in athletes when they get concussed. So your primitive reflexes can come back when you have a concussion later in life, and you can still apply these techniques. So it's a really cool field to study. So when you look at early infant and childhood health, what early signs do you pay attention to in infants and young children? And what do you look for that you wish every parent knew?
Yep, absolutely. And this is just speaking, I think we kind of got away from it a little bit, but speaking to like how chiropractic care for infants is a little bit different, right?
Yes,
it's about
totally. Completely different.
Just to touch on that quickly, it's about 2 to 6 ounces of pressure. So like checking the rightness of a tomato at a grocery store. Sorry, I'll do it again. It's 2 to 6 ounces of pressure. So like checking the ripeness of a tomato at a grocery store. It's very, very gentle, very, very soft. And that's because babies are a bunch of squishy bits, right? Their joints are not fully formed. Their bones are not fully ossified yet. And so understanding that development too is really important if you're going to work in the pediatric population.
Infant chiropractic is more about neurology.
All about neurology and fascia again, and soft tissues, because they have to be squeezed out of a hole that is...
And cranial bones.
This big.
Your cranial bones have to shift. So when we say that the cranial bones don't have joints, this is not true.
Yeah, right. They're just different, right?
Yes, very different.
And so babies' bodies have to squish and squeeze and get through this pathway. And your birth can be very beautiful and not have any trauma associated with it. And baby can still, depending on what their position was in utero, depending on, did they get a little stuck, but not enough for us to really consider it being stuck in the pelvis? Those are things that we track and look for when we're working with the pediatric population in chiropractic. So it looks like I'm doing a whole lot of nothing 99% of the time is what I jokingly tell patients when I'm working with their kids. But
it's because the force is so gentle.
It's so gentle.
There's no cracking in like young pediatric chiropractic at all.
No. It's a combination of chiropractic and craniosacral therapy is what I will say. Like myofascial release, that kind of stuff. And what I have found is a lot of times things like flat spots in the head are more internal pressure issues than external pressure issues. We think like baby's been flat on their back the whole time. Now they have a flat spot here. Kind of, but if those tissues can't stretch as the brain grows and they can't allow the cranium to expand with it, the body's going to adapt, right? And so working through that early on, the earlier the better, because if you wait 6 weeks and now baby really has a flat spot and they're in their stroller or their crib like this all the time, that's 6 weeks of a pattern that we have to work through.
And also addressing upper cervical.
Yes.
Because as you go through a high pressure birth canal, or if you're pulled out with a vacuum or forceps or C-section by your head, it can very much affect the bones in the upper cervical region and the fascia and the tension in that area, which affects your brainstem, which affects your heart rate and your breathing and your ability to latch and all of the...
Well, the jaw, right? Super related. The jaw and the upper cervical spine are considered neurological sisters. There's a reason for that because of their development. Babies' jaws are naturally born slightly recessed. And then as they perfect breastfeeding and bottle feeding, the jaw is going to drop down, come forward and open up that middle ear. So those are things that we try to help with, because if that middle ear can't open and drain effectively, what do we see a lot in toddlers around that time? Chronic ear infections, because that lymphatic,
and sometimes it's fluid buildup.
Yep.
And not a pustulous bacterial infection.
Exactly. Yep. And that's why sometimes tubes get rejected. The body says, no, I don't need these. I need movement. I need space to open.
Yes.
And so yes, those can be tools, and that's not a bad thing if your child did have to get tubes, but this is why we start early on. And, people ask me, well, how early is too early? I said, not really. I've adjusted babies 6 hours after birth. I've adjusted babies. I always recommend no later than 2 weeks. Please.
I think my youngest patient was like 6 days.
Nice. Yeah. It's so cute.
It's really quite an honor to help their nervous system feel safe as they come into this world.
It's such an honor. I am so grateful and honored for every family, mom, partner, anyone who comes and walks through my doors. It's just, I'm always so honored that they trust me enough to be able to walk with them through this journey, because it's a team effort, right? We're all in this together, and my goals are their goals. I have no agenda.
And as we regulate mom as well,
yes,
baby regulates to her nervous system. As we help baby regulate, mom gets to calm down because everyone's happier.
Yeah. And partners too, right?
Yes.
We're regulating partners.
Absolutely.
We're regulating moms. When both of them are regulated and our nervous system, right, can come down a little bit more, then that babies are our direct mirrors. And that is a loaded conversation. And it isn't to shame at all in any way. But I think it's a really great opportunity for us to be able to look at our behaviors and our habits and see what things we want our children to learn.
I could not agree more. So let's end with a future vision. 10 years from now, what do you see the field evolving into and hope becomes standard practice in perinatal and pediatric care, once people understand that pregnancy, birth, and postpartum are not problems to manage, but biological conversations to listen to?
Yeah. I really want to normalize body work.
Yes.
Like
Thank you.
The amount of times I've heard, I was like, well, there's no research to prove that it actually helps anything.
Actually, there is research on this, because they've basically shown that if you take an infant, whether it's a monkey or an orphan or whatever, and they do not receive touch and care, they don't develop correctly neurologically.
Yeah.
And they can die.
Yeah. And I very much so, the whole conversation of research in general, research doesn't negate your lived experience, right? It does not discredit your lived experience at all. And so I really want people to understand that there are so many positive things that come out of body work. And it's not just chiropractic, right? It's acupuncture, it's pelvic floor, it's cranial sacral. They all blend together. And sometimes you need chiropractic more than you need acupuncture. Sometimes you need acupuncture more than you need chiropractic, right? It's fluid. It's not this hard, fast, you have to follow the system. We work with the body. And that's what I love about chiropractic, is what we learned about our philosophy, right? Is an art, a philosophy, and a science. Art is first. And how I like to describe it is what we're doing is bringing people back into their body so they can listen to their intuition and figure out what they really need in that moment.
It's helping them to reconnect with their own innate intelligence.
Yeah. Yep. They are our medium. We're the artists, they're a medium, and we're helping figure out and navigate this entirely different structure that is changing every single day in pregnancy, but then also development in pediatric care as well. The development side of it, there are so many neurological things happening every single day, and to be able to understand and know how to support that really well. I really wish, my hope in the next 10 years is that we can really collaborate with OBs, midwives, in the realm of like, oh, let's start earlier. I don't mind when I see people middle to late third trimester, but would I prefer them to come in a little bit sooner so we don't have to basically bulldoze the house and then rebuild from the ground up in a very short amount of time. In pregnancy, it's a little bit easier because we have relaxin on our side, so we can kind of work through patterns a little bit quicker. But I would rather the advocacy for it is like, actually, you're having really bad reflux, or you're having leg cramps, or you're having restless legs, or pregnancy insomnia, or you're getting headaches in the afternoon. These are all things that can be addressed early on so you don't have to suffer.
And I guess for anyone who might be nervous about seeing a body worker of some sorts, the qualifier I will give for bad versus good is if you are nervous or uncomfortable and they are pushing you through something without helping you to feel comfortable first, it's not the person for you.
Yes.
So just go find somebody who listens to your nervous system and helps you feel comfortable throughout the entire process and modifies their approach to you.
Yeah.
That is the right practitioner.
And don't be afraid to shop around.
Yes,
right?
absolutely.
And I always tell my clients, because Denver, for example, is a transient population, right? There's a lot of transplants here, including myself. But when they choose to get closer to family, right? If their family is on the East Coast or closer to the West Coast, that kind of stuff, I always say my thing is look up and see if they have Webster on their website anywhere, the Webster Technique. It's a foot in the door. But call their office and ask them what other training they have, what other experiences do they have for this. If they just say, well, I've done the Webster certification, that's awesome. And doesn't always mean they're 100% qualified to take the best care of you. So that's always my caveat. I'm like, I don't care what other program they've done. I just want to know that they've done other things too outside of the Webster Technique. And the Webster is super powerful, but it is a weekend seminar. And again, it doesn't go in depth of all the transitions from pregnancy to birth and postpartum. It is a pelvic and sacral technique that is great. And
the extensive training that you and I have done is there's hours and hours and hours and hours of education around neurology and immunology and pediatric development and all of this stuff. Yeah. So yes, I agree that it's really about finding the right fit for you.
Absolutely.
If you were going to leave people with one thing that you wanted them to understand about this transformational experience of the perinatal time, what would you tell them?
I would say you're doing a great job. I want everyone to know that they are doing a great job, whether they feel like they are or not, because you chose to go through this. And sure, there are things that I think can be really helpful, but one of my mentors, this stuck with me and it will stay with me for the rest of my life, is I don't want to should on people, and it's not my role to should on people. And I want them to understand that them taking the steps to learn, them taking the steps to get their foot in the door for body work, congratulations. You are doing an amazing job of trying to navigate this very overwhelming experience, because this might be a conversation for another time, but the business that is behind all these companies that prey on moms doom scrolling at 2 a.m. in the morning when they have their pregnancy insomnia or they're feeding their baby.
We'll go through that in our pediatric care one.
And I just want parents to know that it doesn't have to look pretty. It doesn't have to be this beautiful cookie cutter kind of thing. You are perfect in your entirety, and you're doing an incredible job trying to navigate this very immense situation in terms of transformation, but just like how much we get bombarded with unnecessary things, unnecessary products, different types of learning, education, or we used to do change babies one way and now we're changing them another way, and which one's right and which one's wrong. There is no right and wrong.
Multi-$1,000 machine to wash your bottles, or you can just wash them with your hands.
Oh, yes. Those bottle washers will be my nemesis.
So if people wanted to find out more or work with you, where would you direct them?
Yeah, my website is a great place to start. I think it's very educational, but www.drbrittanyrojo.com, pretty easy.
And that's www.drbrittany, BRITTANY, Rojo, ROJO.com.
Yes. Sorry, I talk kind of fast. And then in terms of practice and like doula support or lactation support, I am an associate chiropractor at Belly Bliss here in Denver. It's a perinatal wellness center. We have acupuncture, chiropractic, massage, yoga, all types of birth education classes there. So that's some in-person work, but I also do some virtual coaching and stuff like that for education as well.
And you do doula work.
Yes.
And you are a certified lactation consultant.
Yes.
All of these wonderful resources for you guys. So thank you so much for being here today.
Thank you for having me.
Thank you for being here and reclaiming your health sovereignty. If you feel ready for deeper guidance and reconnecting to your inner intelligence and finally not going the journey alone, I created the Wellness Evolution community for that exact purpose, for you. It is a place rooted in education, foundational physiology, and community support where you can learn to trust your body again. Visit www.wellnessevolutioncommunity.com for a free quiz to find out where your body is at in your healing stages.